A shocking statistic reveals that nearly 1 in 25 patients in the United States contracts an infection related to their hospital care. More startling, in caregiving environments such as nursing homes and daycare centers, the numbers rise dramatically. Poor infection control isn't just a risk, it's a potential catastrophe. Picture this, a bustling daycare center in the heart of New York City. Over 100 children, each with their unique habits and hygiene practices. Within a week, a harmless cough from a single toddler spirals into an outbreak of the flu. The consequence isn't just a week of missed school. It's a domino effect impacting families, workplaces, and the community at large. Now, shift your focus to a serene nursing home in sunny California. The residents enjoy daily activities, meals together, and the comfort of companionship. But with the arrival of a new resident comes an unexpected guest, a strain of antibiotic-resistant bacteria. Within days, the infection spreads like wildfire. Hospitalizations follow, and the peaceful haven becomes a hotbed of illness. These aren't just hypothetical scenarios. Real lives, real families, and real communities get affected by the consequences of poor infection control. The good news? There's a solution, and it's within reach. Infection control courses offer the knowledge and skills needed to prevent such outbreaks. These courses aren't just for medical professionals. They're for anyone who cares for vulnerable individuals, whether it's a toddler in a daycare center or a senior in a nursing home. Infection control courses equip caregivers with practical strategies to prevent the spread of infections. They cover everything from basic hand hygiene to the use of personal protective equipment and the management of infectious diseases. But it's not just about knowledge, it's about transforming that knowledge into action. Remember the daycare center in New York City. With an infection control course, caregivers can identify the early signs of an outbreak and take immediate action. They can implement strict hygiene practices, isolate the affected children, and prevent the flu from spreading like wildfire. And the nursing home in California? Armed with the knowledge from an infection control course, the staff can act quickly when a new resident arrives. They can take the necessary precautions, isolate the resident until they're sure there's no risk, and protect the other residents from potential harm. Infection control courses can make a world of difference. They can turn potential catastrophes into manageable incidents. They can protect the most vulnerable among us from harm. They can save lives. So, consider taking an infection control course. It's a small investment that can have a big impact. It's not just about protecting yourself. It's about safeguarding the health and well-being of those you care for. Because at the end of the day, that's what caregiving is all about.